There are many diseases, MS, Parkinson's, Alzheimer's, brain tumors. These are devastating illnesses to patients, as we all know. These are illnesses that, in many cases, have provided, medical science has not provided quite the hope that we do in many other situations. As we all know, this is an area where the science that we're talking about in these sessions and the enormously phenomenal work that's going on at places like the Brigham, Mass General, and many other centers around this country are here to provide the hope for patients that we know can be achieved given the great science that we all understand is happening at these wonderful institutions. Many of the sessions here have focused on what that science is and what the path for, and I'm always reluctant to use the word cure, but what the path to cures are for many of these otherwise devastating diseases. But this morning, we're focusing not on the nature of these diseases from a scientific perspective necessarily, but the nature of these diseases from a patient perspective. There are many patients, including my mother-in-law, who had gone through some of these diseases with incredible dignity and with the ability to see through what sometimes is the day-to-day difficulties that they all encompass. And they do so in a way that inspires all of us. Today, we are joined by somebody who provides that inspiration not just to her family, but I think to the entire nation. Ann Romney is an individual who has suffered from MS, but is an outstanding example of somebody who has dealt with the disease in a way that gives all of us hope. She is in remission. She has done some remarkable things over the last few years for those of you who aren't from this planet. And one of the more remarkable things going forward is the Ann Romney Center for Neurologic Diseases. This is a center that will be dedicated to helping to solve the difficult problems that we're all here to understand in more detailed and better ways. Our intent is for the center to be a catalyst for research that is groundbreaking and will truly make a difference in patients' lives. As we look forward, it is my hope that we'll come back here year after year and we will see the enormous progress that comes out of efforts like the Ann Romney Center. But this morning, I am an introducer of an introducer. So it's my pleasure to hand the microphone over to a medical and media professional who I think all of you who saw her terrific interview with Jeff Immelt last night will applaud as an incredibly talented physician and correspondent and interviewer. So please let me welcome Dr. Nancy Snyderman to the
Thank you, Scott.
already on the stage.
Thank you so much. Good morning, everybody. Well, this friendship developed over a horse. Had nothing to do with doctor-patient, had nothing to do with politics. I was on loan to NBC Sports, and I was really focused on one thing in my life, and that was Rafalco. And I wanted to follow this fabulous horse from Gladstone, which is just north of Princeton, where I live, to London. So I was all about chasing down Ann Romney, knocking her out of the way, and getting to her horse. And it worked. And we ended up sitting in the stands and watching her horse perform and became friends. And so it's an honor today to sit with her and to watch her really go from global figure, beloved American woman, patient to advocate. And that's a little bit about what we're going to talk about today. But Ann, I want to start with 1998 when you were diagnosed. How did you know something was wrong?
Well, again, I'm so grateful for those that are in the audience that are working on trying to cure and help these people that are suffering. But there was something that was going on that I just knew was just really wrong, more than I had a flu. It was ongoing, the fatigue, the loss of balance, and yet I had no idea what was wrong with me. Had not even a clue. I just knew it was something big. It was not something that was going to go away.
Was that something in your gut that told you this really?
Something big. And you know, I had, my brother's a doctor, and I called him, and he listened to me, and I said, you know, I'm just so tired. And I'm also stumbling a bit, and my right leg was going numb. And he instantly said, well, you need to see a neurologist. And I'm like, why would I do that? I mean, you really just beginning of not having any idea what was going on.
And when you got the diagnosis of multiple sclerosis, what was your reaction?
Well, when I went to the office, it was with my husband, Mitt, and we were waiting in the waiting room, and there was a pamphlet in this neurologist's office, and on the disease listing and the pamphlet were multiple sclerosis and ALS. And as I'm reading the descriptions, I'm like, I think I have one or the other. I wasn't sure, because some of the symptoms are very similar.
In your head, were you thinking,
head,
I would like this one rather than that one?
Of course. You're thinking, eeny, meeny, miny, mo, AMS or ALS, let's go with MS. But it wasn't, it was quite a moment when you get that diagnosis. The diagnostic tools now are sophisticated enough where you can do the MRIs and see plaque and sclerosis. And so that with all of the other things was a pretty, it was nice to know that I could put a label on it, because then I could tell everybody I am really sick. I was trying to keep up. I was just trying to just make my life as normal as I could still, and yet I was losing that race. I was falling further and further behind.
It's always so interesting to me, because you know, you fall on sort of one edge of the age spectrum for getting this diagnosis, but so many times women in their 30s and 40s who start developing these symptoms are seen as malingerers, or maybe it's chronic fatigue, or it's all in your head, or it's stress, and they're sort of thrown in the wastebasket of it all.
Yeah, and I think that you know, it's important as caregivers for us to recognize that, you know, women that present some of these issues, there is something going on that's wrong in our bodies, and that we've got to figure out what it is to make us feel better and how to approach that. And sometimes it's Western medicine, and sometimes it's Western medicine and Eastern medicine, I believe.
I don't even call that alternative anymore. I think it's complementary.
Yes.
Yeah, interesting. So I always tell patients, don't go to the doctor alone. And don't necessarily take your best friend, take your meanest friend. Take the pit bull who's going to really be your champion, because in the heat of the moment, it's hard to hear things about yourself and distill the information. Did you and Mitt walk out having heard different things?
We basically walked out at that point in 1998 when I was diagnosed with, come back when you're sick or sicker. And I thought to myself, aha, I can barely function. And there was really no treatment that was prescribed for me. It was like pat on the back, goodbye.
Buck up, Bucky.
Yeah. And that was shocking to me, because I'm like, wait a minute, someone's got to give me a pill here. I can't just walk out because I'm so sick. And that's the answer. And so, but it was wonderful to, a few months later, to find Dr. Weiner from the Brigham, and to say the different approach was, no, we're going to hit it as hard and fast as we can, early. And that was a change, and that was a shift. And I was so fortunate to be able to get treated at the Brigham.
So when you met Dr. Weiner, and he talked about early treatment to make the progression, to sort of stop it in its tracks, take us through the therapies that were introduced to you early.
Well, I went to his visit. It was quite extraordinary. We sat down. He looked at my MRI. He did a quick exam. And we spent 10, 15 minutes, and Mitt was there again, and he's like, this, okay? He took me by the hand that minute. At that point, his offices were in the Brigham, and he took me to an infusion room from the visit, right there. And it was such a shock to me, but it was such a relief too, to know that someone was going to address this, and someone was going to be aggressively addressing this, and I was so relieved. Now, the treatment was IV infusion of steroids, so it wasn't like, it wasn't a great trip. And it was sobering too, because in the infusion room were people that were very progressed with MS. And there were, I saw the bladder bags and all of these things, and in the wheelchairs, and it was like, okay, this is my life now. It was a huge shift, and thinking to myself, well, this is where I am. And it was just like the world was spinning around, and there I was, frozen in time, in a room, in an infusion room now with very, very sick people.
At what point in this journey did you cry?
Mitt and I cried in the doctor's office with the first diagnosis, but after that point, I don't think I did. It was just, again, toughen up. But there was also something else that happened, and it was, even though my husband was so supportive, my children were so supportive, I had, a good doctor, this was my journey alone. Mm-hmm. And I had to figure out so much myself. And I was very frightened. And even though the answers were not good answers, I had to figure almost everything out myself.
At what point, when you walked into that infusion room and you saw the downward track of what an MS diagnosis could be, did you think, well, I'm not going to go there. I'm not going to have a bladder bag. I'm still going to be able to walk and sustain the kind of life I want for the rest of my life?
Frankly, I have to say, for early diagnosis, there's almost a numbness that comes over you, where you don't want to think about that at all, that you just have to exist in the moment and just say, this is where I am right now. And there's a fear that happens, there's this little cloud that moves over your head that never leaves, and it's still there. I always have the fear of what might happen and when the shoe is going to drop.
So you have
again.
Damocles' sword over your head all the time.
I sort of do, and I think people with this diagnosis never know when it might flip into an active state again.
So how frustrating is it for you when people look at you and say, but you look terrific, you can't, things can't be wrong?
It was really hard, especially at the beginning, where I was doing so many things. I was on a lot of boards, I was doing, from the schools with my children, I was doing all these things, and yet I had no energy to do any of it, and yet I looked the same. Mm-hmm. And it was a nice excuse to say, oh, I'm so sorry, I have MS, I can't. But people wouldn't believe that because they
And you could tell immediately, couldn't you?
Yeah.
Yeah, in people's faces.
Yeah, you could. But it was frustrating to me to say, you really should just be putting your arms around me and tucking me in bed.
What medicine are you on now?
I'm on nothing right now. And I don't obviously want to talk a lot about that because most people with MS need to be on continuous medication. But with Dr. Weiner, he and I have come to this point where we know if I get into a long-term attack again, we know what works for me. But we also know right now I'm okay by just doing what I do. I do a lot though, Nancy. I was
going to say, there is an armamentarium of stuff waiting there for you, which must give you great confidence and solace.
Yes, it does.
We talked a little bit last night at dinner about the things you do that are those simple lifestyle changes that I think people used to really scoff about and think they're nonsense. You've embraced them.
Absolutely. And I am very active physically. And I have to say the horseback riding really is a huge piece of that. And it's not just physical, it's emotional, it's joyful, finding something you absolutely are passionate about, that you love. And there's diet, which I'm very aggressive with as well.
What won't you eat?
sugar.
Refined sugar?
Sugar.
Sugar. How about bread?
I'll take like
Enough to just satiate.
a tiny bite.
How about alcohol?
No alcohol.
Okay. And are those triggers, or do you just fear that they might cause trouble?
I just know I function better without it. I get fuzzier.
Your brain gets fuzzier.
I get fuzzier with it. And so I just have more clarity, more energy when I'm eating in a really, well, we say clean way. But, you know, I love to juice. I have my green drink. I feel great if I drink that yucky stuff. I make Mitt drink them. And he literally like...
Tell me you put enough mint in there to hide everything else.
I'm like, no, this is hardcore. Just drink it. I mean, no, you know, it's just like the spinach, the kale.
Nothing like a convert.
The ginger. And I just say, just drink it. And so, yeah.
When you decided to open the Ann Romney Center at the Brigham, you chose not just MS, but 5 neurological diseases. Why not just focus on yourself?
Well, Dr. Weiner is the most brilliant guy, and Dr. Dennis Selko, I am so excited about this new adventure that we are all on together with these extraordinary doctors and Dr. Betsy Nabel at the Brigham to be able to have the vision to see what the potential could be for joining these diseases together, as we all know. Multiple sclerosis, Alzheimer's, ALS, Parkinson's, brain tumors, they're all in the brain. And it's the interdisciplinary study of each of these that we hope will accelerate the research and just explode the development of cures and treatments for these diseases.
This audience knows so well that the history of medicine has been so siloed, and people have like owned a disease and not necessarily shared. You're talking about a very horizontal model of neurologic progress.
I have to also say that Mitt had a big piece of this.
Really, I was going to say in such a female approach.
That when I was talking about it, it was Mitt was saying, again, you've got to break down the silos. You've got to have communication because it's frustrating for all those of us that watch from the outside and see medicine where they study in a silo and they don't share. And he goes, there has to be collaboration. If you really want to make progress, you have to change things.
Through you, Jan Eibling, this fabulous trainer and rider, an Olympic team member who rides in California, and I've become friends. And I asked him about the first time he saw you on a horse. And he said, you couldn't sit on a horse.
Yeah.
Your balance was so off. He said he remembers thinking, this will never work.
Oh yeah, I know. He every once in a while reminds me of how like bad I was.
I don't think he used that word to me.
But how weak, really, it's weak.
You were really weak.
It
and
was
you were really
very
off
weak.
center.
Yeah, off balance, no core strength, no strength. And you know, and I think I had also just kind of, I feel like there's a foreign invasion that happens in that first year when I was first really became quite sick, where you are just, your equilibrium is just off and you haven't figured everything out yet. And I didn't even know what I should be doing. Was this safe for me to be doing something like this? So I'm very excited about the fact that we're introducing something new today. So,
before I get to that, I want to go back to something you just said, which was safe. How many people said to you, are you out of your mind? You're having trouble walking, your equilibrium is off, and now you're getting on a large animal who, except for you and I, most people think aren't very bright creatures.
Well,
We're the exception to the rule.
No, and you know, it was just even, I think yesterday that Mitt's going, do you know, just talking to a doctor, and he said, he's an orthopedic guy, and you know the people he treats the most are motorcycle accidents and horse accidents. Did you know that? I mean, it's like every week he's telling me like how dangerous this is. And I'm like, yeah.
Well, what has riding done for you?
Oh, it's just been, it's been wonderful. It's also something that's...
Because you took a lot of heat. I mean, you know, the country loved to laugh at it all.
Right.
But through it, I thought, they don't understand the love of a woman and her horse and that symbiotic relationship.
Yeah, it's fantastic. It's mine. It's the thing. I own it. It's my thing. It's what I love. It's this relationship that I have with the horse. It's just fantastic. I can't wait every day to get back on a horse. So it's been wonderful for me. It's given me my own thing too. It's like my kids don't care about it. My husband doesn't really care about it because he always thinks I'm going to die. But it's, you know, it's my deal, and I've, you know, I've really conquered that too. Like
You've conquered it well.
Yeah.
And equine therapy has been shown to work for a lot of illnesses. Why not? Why not MS and other neurologic illnesses?
Well, there's wonderful equine therapies, as you know, programs.
Yep.
I know you support them, I support them.
Yep. So today's this very special day, besides the fact that we get to address a very august body of people, because you're really launching this center for real.
Yeah.
On a social media campaign. So I'd like to take a second, and we have a video we'd like to show you. And this is really, I think, one of the most important things Ann Romney's probably ever done in her life, other than have those babies. So let's roll the videotape, please.
My name is Montel Williams, and I'm one of the 50 million faces of neurologic disease.
I'm Jack Osborne, and I'm one of the 50 million faces of neurologic disease.
My name is Andrea, and my mother is one of the 50 million faces.
My name is Nicole. My name is Marcia.
My name is Susan.
My name is Nancy.
My name is Steve.
And I am one of the 50 million faces.
And I'm one of the 50 million faces.
And my parents are among the 50 million faces.
And my son Pete is one of the 50 million faces.
And my husband Michael is one of the 50 million faces.
My name is Ann, and I'm one of the 50 million faces of neurologic disease. I know what it feels like to be frightened and hopeless. And when you receive your diagnosis, that is a terrible place to be. But there is something we can all do. We can share our stories and create a community of hope.
The Ann Romney Center for Neurologic Diseases at the Brigham is accelerating treatments and cures for 5 of the world's most complex neurologic diseases.
Multiple sclerosis, Alzheimer's disease, ALS, Parkinson's disease, and brain tumors.
I was diagnosed with a tennis ball-sized astrocytoma brain tumor.
I wanted to live a full life. I wanted to have kids. I wanted to get married.
I wasn't so much scared at first as I was frustrated.
It was a very scary experience for me.
When we were first given the diagnosis that our 27-year-old son had ALS, I felt devastated, panicked.
We have a lot of challenges and we suffer and we have a lot of problems that people just, it's not apparent on the surface. There's strength in numbers.
There's so much power in one person communicating to another person about what's going on, where they're at, how they're feeling.
Until we start to talk about it, change can't happen.
By sharing our deeply moving stories, we can focus the eyes of the world on finding new treatments, preventions, and cures through research.
Join me.
Join me.
Join us.
Join us.
Join us.
Join us today.
Share your story.
By bringing our 50 million voices and stories together,
We will be heard all over the world.
Where does this launch today, and what are your goals for it?
I mean, it was all said in the video. I'm so excited. I have to say, I would have loved to have known this existed when I was first diagnosed. Everyone has a story. And it's not just the person that's diagnosed, it's their family members that get impacted. And, you know, we can have power in numbers. And I like to say that we are one of the wounded, but the stripes we've earned make us stronger and make us more understanding of what everyone else is going through. So again, it is going to be such an opportunity for us to join together and battle together to fight neurologic disease.
Is this a comfortable place for you to go from patient to advocate?
I don't really think of myself as advocate.
You are now. I'm just going to designate you.
I don't think of it that. I just think, I have to say, when I was on the campaign trail, what happened was so extraordinary. We would be at rallies where you'd have to get there hours and hours and hours and hours before the event to be able to get to the front. And there would be thousands and thousands of people there. And very, very often, you know, there'd be the police, you know, barricade lines, and there would be, when I would get there, there would be people at the front of the lines hanging on to them, and I knew who they were. They were people with MS, and they'd been there for hours and hours waiting just to say thank you to me for being an example for them and a strength for them. And it's now time for me to be a strength for them. So I was impacted so deeply by that. Very often when they would see me, they would collapse because they're physically, they've been holding it together, and it would be hot, or they'd be tired, or, you know, it's hard for them to stand that long, and they would collapse when they saw me. And yet they were there for me. And I'm like, now I want to be there for them. I want to be able to say, we're in this together. And I just want to have a vehicle to let that happen.
And in the bigger scheme of things, do you see this now as an international resource?
I certainly hope so, because the 50 million faces is not US faces, it's world faces.
And social media.
Yeah, it can be a huge, huge vehicle.
I'd like to invite somebody up to the stage who's been an integral part of this. I mean, no one person does anything alone. Betsy Nabel, who's president of the Brigham and Women's, is here. Another friend. It's amazing what happens when you get a few broads together.
Hi, Betsy.
Great to see you.
Betsy, are you mic'd, or would you mind taking the podium?
Yeah. Thank you so much, Nancy, and your story this morning has been so moving to all of us. We all just have tears in our eyes. I just want to thank you for what you have done for so many people around the world with neurologic diseases. You have told your story beautifully. You reach out and are so empathic for so many people, and you've now provided so many with a vehicle to tell their stories. We simply thank you for this remarkable gift, and we thank you for your friendship, and we look forward to continuing to work together. Thank you so very, very much.
Thank you, Betsy. Great.
It's good. Yeah.
As you go forward, and today becomes your official launch, you've spoken about the female brain being a different entity, perhaps, than the male brain.
Now, this could lead to a joke, but it's not.
No, in fact, you know, we process drugs differently, we think differently, we get diseases differently. I mean, the idea that one disease should manifest itself the same way in you versus Mitt, I mean, I think it's the old dogma. So without segregating women from the research population, what do you want to see zeroed in with regard to women's health in the brain?
Well, the first thing is we have to recognize that women get some of these neurologic diseases at a much higher rate of incidence. MS, Alzheimer's, and we have to start asking this question, why? And it's beyond a simple answer of estrogen. And so for me, that's another big threshold where we've seen, again, the progress that's been made in lung disease and heart disease, cancer. There's more treatments, there's more cure, we've seen progress, but there's been so little progress with neurologic diseases, and I just sort of feel like now is the time. The diagnostic tools are there, the resources are, we are going to have to start harnessing them, but we're also going to have to start asking more questions of why, and why more women. And so for me, that's another piece of what we're going to want to accomplish
Tackling
here.
the last great frontier, and then tying it into the rest of the physical body.
Right.
Well, I want to thank you for your candor, for your honesty, your truth, your leadership, and for me personally, your friendship.
Wonderful. Thank you, Nancy.
Quite extraordinary. Ann Romney, everyone.